We have with us in the studio today Dr. Yele Aluko. He's a cardiologist by profession. He's been in the profession for the past 23 years. He has one of the largest group in Charlotte, North Carolina. And he started probably alone as a solo practitioner, and I believe there are about 41 of them today. We're going to be talking to him about the profession of cardiology.
Thank you.
Dr. Aluko, how long have you been in the practice of cardiology?
Well, I've been in private practice of cardiovascular medicine for 23 years in Charlotte, North Carolina.
What really is cardiology? For some of our viewers who don't know much about that specialty, can you?
Well, cardiology, sometimes referred to as cardiovascular medicine, refers to treatment of disorders of the heart and the blood vessels. As you know, the heart is essentially a pump, and the function of the heart is simply to pump blood out of the heart to all the bodily organs. So the liver needs blood, the kidneys need blood, the brain needs blood, the heart itself needs blood. So the heart pumps blood that is rich in oxygen to the tissues of the body. It does so by pumping blood through blood vessels. So you can consider the heart to be a pump and the blood vessels to be the pipes that work in like a hydraulic system. When the body organs receive the oxygen and extract oxygen, then the blood is returned to the heart through different kinds of pipes called veins. The types of pipes that take blood from the heart to the tissues are called arteries. And once the tissues extract the oxygen, the blood is returned through different pipes called veins. Once the blood is returned to the heart pumps the blood to the lungs, and the main purpose of doing so is so that this blood that is now depleted of oxygen gets oxygenated. In other words, it gets oxygen in the lungs. Once this blood is now enriched with oxygen, it is returned to the heart, and the heart begins the cycle again by pumping oxygen-rich blood to the tissues. So it's a continuous cycle of blood delivery to the tissues and blood return from the tissues.
So what you just described to us is really makes the heart a very vital organ for the whole body. It's probably one of the most important organs in the body. Would you say that?
Without any question, there are several important organs, but there's no doubt that the heart is definitely a critically important organ, because if the heart is not functioning, the consequences are dire and they are significant. Patients that have poorly functioning hearts have a reduced lifespan, have increased or reduced sense of well-being, and increased problems with health in general.
How would a patient know that his heart is not functioning properly?
Well, there are a variety of problems with the heart. And like I mentioned earlier, the heart is a pump. The heart also delivers blood through blood vessels. The heart itself has blood vessels that take blood to it to make it function. And also the heart has electrical capacity within it. So there are three broad categories of potential problems that one can have with the heart problem. If the pump itself is not working well, if the heart is weak and the pump is not able to effectively pump, then you are not able to deliver blood to the tissues. We call that congestive heart failure. There are a certain set of symptoms that are often associated with congestive heart failure, such as shortness of breath, fatigue, swelling in the legs, swelling in the abdomen, difficulty lying down flat, waking up in the night because you can't breathe. Those are all symptoms that are suggestive of a weak heart muscle that is not able to pump blood effectively out of the heart. So that refers to problems of the pump. The second category of problems is problems of the blood vessels that take blood to the muscle of the heart. If you have blockages in blood vessels, what we refer to as coronary artery disease, then the heart itself is not getting enough blood, and the heart itself may get damaged. The symptoms of that syndrome I've just described, coronary artery disease, is usually chest pain, what we refer to as angina. It's usually chest pain, chest discomfort, chest heaviness, which is more apparent when people are exerting themselves, like climbing up the stairs, carrying suitcases. And that is because there's a blockage in the coronary arteries that is not allowing blood to get to the heart muscle. So the heart muscle reacts by creating pain. The potential complication of that syndrome is that blockages, if left unattended and they progress, they can cause what we refer to as a myocardial infarction. In layman's terms, that's a heart attack. In other words, the heart muscle will die, and that is attendant with a fair amount of pain. And of course, the consequences of that could be death. So I've described, one, a problem with the heart muscle. Second, a problem with the blood vessels that take blood to the heart. A third category is a problem with the electrical system of the heart. Now, everybody understands that the heart beats. A normal heart beats about 60 to 100 times a minute at rest. The reason the heart beats predictably is because there is internal electricity in the heart, which starts in an area of the heart we call the pacemaker, which is in the top right side of the heart. And that pacemaker generates electricity that makes the top chambers pump, and this electricity travels downwards to the bottom of the heart, which then makes the bottom chambers pump. So the normal heart function is driven by efficient electrical generation that results in sequential pumping, the top and the bottom. If you have problems with electricity of the heart, for example, if the pacemaker stops, then the heart doesn't beat. The heart may not be weak. The heart may not have a problem with blockages. It may simply have a problem with electricity. And the heart may just stop. And of course, if the heart stops, there's no circulation of blood. So we call that conduction system disease. Some people have very slow heart rates. A normal heart rate, like I said, is 60 beats a minute to 80, 90 beats a minute at rest. Some people, especially in the elderly, have heartbeats in the 30s. And in that situation, people can pass out. They can feel dizzy. If they pass out, they may have seizures. So in broad strokes, those are the three large categories of problems we deal with when we talk about problems of the heart.
Okay. Now, which of those three that you described is more common in the United States as opposed to a third world country?
The biggest component of heart problems that we see in the United States and actually in the Western world is problems with coronary artery disease and heart attacks. And one must understand that problems with heart attacks can actually result in congestive heart failure too. But there's a high incidence of coronary artery disease in the Western world compared to other countries. It's also important to understand that coronary artery disease is generally a disease of risk factors. And by risk factors, a risk factor is a condition that predisposes a person to the development of pathology, to the development of disease. So the reason why there is a preponderance of coronary artery disease in this country as compared to others is because there is a higher incidence of the risk factors that lead to blockages in the coronary arteries. And these risk factors are well known: high blood pressure, referred to as hypertension, cigarette smoking, high cholesterol, and diabetes. So an accumulation of these risk factors predisposes people to the development of coronary artery disease that results in angina, chest pain, or can result in a heart attack, or sudden death, whereby the first manifestation is a patient suddenly drops dead without warning.
So, but on the other hand, in the third world countries, it seems as if, from what I hear, they have more of the congestive type thing. Does that have anything to do with the availability of care, drugs, medical treatment, or maybe good medication to prevent that? Or why is that discrepancy? I know that here, maybe the kind of diet, as you mentioned, and cigarette smoking, but on the other hand, why is there this discrepancy?
Well, in the third world, again, like I mentioned, one has to focus on the fact that heart disease is dependent on the presence of risk factors. And in whatever population you are in or whatever part of the world you are in, if you have the risk factors, you will end up developing the consequences of the risk factors. There is a higher incidence of high cholesterol based on dietary preferences here in the Western world as compared to the third world. But in the third world, there's a high incidence of high blood pressure, and there's an increasing incidence of diabetes. And as you well know, there is now an increasing global pandemic of obesity. So the incidence of heart disease in the third world is actually rising, and it's rising for a number of reasons, one of which is the urbanization in certain pockets of the third world that is attendant with modified lifestyles that expose people to the risk factors. So that's one reason. There's an increased incidence of smoking in the third world that has also resulted in increased risk of heart disease. But there's also a body of literature that suggests that the diagnosis of heart disease is underreported in the third world, simply based on the lack of equitable infrastructure and the ability to diagnose. But if you compare populations in Africa and the Caribbean and the United States, specifically looking at the penetration of heart disease in black people, there is less evidence there's less penetration of heart disease in Africa compared to Jamaica, the Caribbean. The Caribbean is higher than Africa. And African Americans living in the United States, it is the highest compared to the spectrum of black people. Interesting
comparison. Now, what are the tests available for an average person to be able to know that they definitely, I know those symptoms are there, but there are times in which the symptoms may be a heart attack, for example, but it may not be. What are the tests that are available out there for patients?
There are several tests, but what I would suggest is that patients need to focus on understanding the importance of prevention. And patients should also be self-empowered to understand what symptoms could be. Patients should not go to physicians' offices asking to be tested for heart disease. Patients should, in general, adopt healthy lifestyles. In general, that will limit exposure to disease in all organ systems, whether it's gastrointestinal, which is the stomach, pancreas, or otherwise. That being said, one also needs to understand the importance of regular annual physical examinations. And during the physical examination, there needs to be interaction between the patient and the physician, whereby the patient needs to know depending on his or her age or family history. If they are diabetic, is there a family history of diabetes, the patient needs to walk out of the doctor's office knowing whether they are at risk for diabetes or not, or if they are diabetic, is the diabetes controlled? Secondly, they need to know if they are at risk for high blood pressure.
Yeah.
They need to know what their blood pressure is. And if it is abnormal, they need to understand why. And they need to come up with a conjoint plan with the doctor as to what needs to be done to fix the blood pressure.
Yeah.
Options would be diet or medications. If a person is diagnosed with high blood pressure and requires medicines, there needs to be a quick turnaround with another doctor's visit 2 to 3 weeks later to see if the medicines are working. There are particular goals that we need blood pressures to get to reduce the risk. So it is pointless taking medications for high blood pressure if you're not normalizing the blood pressure to reduce your risk for the development of heart disease. Same thing goes for cholesterol. A patient needs to know what one's cholesterol is. If it is not controlled, you have to have a dialogue with your physician as to how to control it. And there needs to be a quick turnaround to see if the mechanisms that are put in place are working. If they are not working, you need to understand why. Maybe the dose of the medication is too low. Maybe the patient is not taking the medicines. Maybe the diet has not been modified. So there's got to be an interactive process to look at your risk factor profile and normalize it. And this needs to be done every single year. I mentioned age. You know, if one is above the age of 50, and talking globally about disease in general, we talk about gastrointestinal disease. Is that person at risk for colon cancer? And what the dialogue has to happen. The patient must be empowered with knowledge to realize that above the age of 50, the risk for colon cancer rises and the importance of screening becomes evident. And for males, prostate cancer. So it's an issue of understanding, being educated, being empowered, and developing a relationship, taking the responsibility to have annual physical examinations.
So, so the first thing the patient should really do is to actually be very proactive and really do certain things to prevent them from having. And if for any reason they don't do that, or maybe because of the family practice, then you go to the next level of doing some more tests.
Correct. Now you asked about tests, and there are several tests. So if a person comes in complaining of chest pain, and there is a suspicion that the chest pain is being caused by poor circulation to the heart because of blockages, what we refer to as angina, then the first thing we would do is we would take a good history as to what kind of pain it is. The pain is usually exertional. Oftentimes it is somewhere in the chest. It could be on the left side, it could be in the center. People describe it sometimes as a pressure. Sometimes it radiates up the neck, to the shoulders, to the jaw. Those descriptors become concerning because they are almost textbook descriptors of angina. So there's a higher suspicion that there's a problem. The doctor will then do an examination, listen to the lungs and the heart. Sometimes you hear things in the chest with a stethoscope that further reinforce your suspicion. There are normally 2 heart sounds that one should have. If the heart is under stress, you may have a 3rd heart sound or a 4th heart sound. That further raises the suspicion that there may be a problem. If there's fluid in the lungs, one may hear that with a stethoscope. That again reinforces the suspicion that there may be a heart problem. If there's swelling of the ankles. So that's a physical examination. One will then do a chest x-ray, which gives us an idea as to, is this heart normal in size or is it enlarged? If it's enlarged, again, there's a concern. And then we do an electrocardiogram, which is an analysis of the electrical activities of the heart on paper. It is a graphic representation of the electrical activities of the heart on paper. If people have had heart attacks, sometimes you can see it on an electrocardiogram. If somebody has had a heart attack, there's a high likelihood that this person has a blockage. There are certain abnormalities that you can see on the electrocardiogram, even if people haven't had a heart attack, that further increase your suspicion that there may be a problem. We can do something called an echocardiogram, which is an ultrasound of the heart, where we can actually use sound waves through the chest wall that show us the heart pumping. It can show us if there are areas of the heart that are not doing what they should do. It tells us if the valves are opening and closing properly. We can do a stress test where we put a patient on a treadmill and we observe their blood pressure, their heart rate with exercise, but most importantly, we observe the change of the electrocardiogram with exercise. There can be some specific abnormalities on the treadmill that can lead us to either exclude, that can lead us to actually diagnose a heart problem based on the abnormalities, or if it's completely normal, the index of suspicion may drop. So there's a battery of tests that can be done. I haven't mentioned more tests such as a heart catheterization, which is a very sophisticated test where we inject dye by passing a catheter through the artery, either in the wrist or in the groin. The catheter goes all the way up to the heart, and we actually inject dye directly into the heart to look for blockages in the blood vessels taking blood to the heart.
Okay. So physical exam, then maybe the EKG, the electrocardiogram, and then you go further to the echocardiogram, and then you can do you say stress test, in which that's when they run on the back that thing, right? The
treadmill, yes.
Yes, the treadmill, and then you can go further to the cardiac catheterization. How risky is that?
The cardiac catheterization is a very safe procedure if it's done by people trained to do it. It's a very safe procedure. The risk is less than 1 in 1,000. Okay. Every procedure has some risk. The risks of a catheterization could be bleeding because you're going into blood vessels. There could be damage to the heart muscle, irregular heartbeats, damage to blood vessels, but done by skilled people, and there's several catheterization laboratories and personnel that do procedures well. One has to weigh the risk of the procedure versus the benefit of the information that one is going to obtain. If a person has symptoms that do not sound cardiac, if a person has a normal electrocardiogram and a normal stress test, even though the risk of a catheterization is small, there's no point doing a catheterization on such a person, because even though the risk is small, a person doesn't need a small risk if it is not an indicated procedure.
Okay. So, and then if they discover something, is that when do the bypass surgery, or you use the medication? Which one is in vogue now? Is it?
Well, it depends on what the patient has. If people have blockages in their arteries that are causing symptoms of chest pain or other types of related symptoms, then there is a spectrum of treatment modalities, one of which is medications. There are certain types of medicines that have been shown to reduce chest pain by improving blood flow, by making the blood vessels dilate, in other words, expand, so that more blood is delivered to the heart muscle to prevent chest pain. That is usually medications used when patients have moderate disease. Patients that have severe disease, medications may not work effectively. And for those patients, they require some type of procedure that we call coronary intervention. And it could either be intervention by surgery, which would be bypass surgery, where a cardiothoracic surgeon will open the chest and reroute blood flow. There is another procedure that is done very commonly called coronary angioplasty, where we can use a balloon to open up the blockage by passing a catheter through the groin or the wrist, and also placing what we call a coronary stent. A stent is a metal tube, like the inside of a pen, that is used to prop the artery open. So a variety of procedures depending on what the patient has.
Dr. Aluko has been very enlightening, and I'm sure our viewers will really learn from this. And if they have any cardiac-related problems or heart-related problems, we're going to be, especially if they're close to Charlotte, we're going to be asking them to call on you. Is that okay?
That's fine, and I appreciate the invitation. It's been a pleasure talking to you.
Thank you very much.
Thank you very much.